Hi, my name is Brianna Herbolario, and I will be doing the conclusion and a review of the epidemiological terms within this presentation. In 2006, the United States devised a national plan to eliminate syphilis. Syphilis is easy to detect and diagnose, and so the United States, up until 2013, had a plan to eliminate this sexually transmitted infection at the borders of the country. The plan involved different strategies, such as the development of a syphilis outbreak plan, as well as an enhanced health promotion. However, this plan did not work over time as there was still an increased number of cases with primary and secondary syphilis. There is also a need for a syphilis vaccine as previous research attempted to develop a vaccine, but none were proved to be successful. The syphilis epidemic continues to fluctuate over time, which means it is necessary to reduce the incidence to further decrease the linkage between syphilis and also HIV. Vaccinations would help reduce the incidence of syphilis and would also reduce the linkage between both syphilis and HIV. There are antibiotics, such as penicillin, that help in treating syphilis. However, the public health goal is to prevent syphilis from spreading in order to reduce the morbidity and mortality rates of the infection. Finding a vaccination for syphilis would be cost-effective, as it would provide a better source of prevention rather than continuously providing medications and antibiotics to treat the diagnosed cases of syphilis. Furthermore, there is also a prominent increase in syphilis morbidity for men. Even more so, there is an increased prevalence with men who identify as bisexual, gay, or have sex with other men. And this could be seen in the following chart. It is shown that men who have sex with other men have a higher distribution of primary and secondary syphilis, with about 52%, in comparison to men who have sex with only women at about 15%. So what would our group do with the $100 million for syphilis? As stated before, there is a prominent need for a syphilis vaccine, as the public health goal is to prevent syphilis from spreading in order to reduce the morbidity and mortality rates of infection. With the proper funding, the portion of the money could go towards public health organizations as well as partnerships to improve public health interventions and screenings for syphilis. We could further enhance the screenings for syphilis and further provide better health facilities to reduce the incidence. Lastly, as stated by Ashley Grant previously, we should use this money to increase surveillance data to review the patterns of syphilis morbidity across the United States. And these are the current epidemiological terms that we have used within our presentation. And then these are our references. Thank you guys so much for listening.